Hi, this is Doug and Cindy. Welcome back to Help Me Help Mama 5cast, and glad you're with us today. We're going to take a minute and talk about a topic that comes up periodically. Does mom admit to needing help? Does she admit to needing help? When you go, you've been noticing things maybe that are not quite right, but when you go to visit mom, does she tell you, I'm having trouble remembering taking my medicines. Can you help me with that? Or does she say, when I went to the grocery store yesterday, I got lost and I couldn't, does she say that, or does she just like
I've never heard anybody say that or
admit
admit
to
that their
needing?
loved one admitted to needing help. A lot of times they try to hide it. It may be a personality thing though, or it may be that they want help. Maybe they've always been kind of pampered and watched after their whole life, and now it's just easier if somebody goes to get their groceries or somebody comes to get them to take them to the doctor. And
Now I've seen that, where mom says this, it's kind of a convenience thing.
yeah,
Yeah, but if that's kind of the difference in wanting help versus needing help. It's like if you need help, so why wouldn't you think mom would say, I need some help? I'm forgetting some stuff, or I'm forgetting to take my meds, or one thought that crosses my mind, to answer my own question here, I think that it's maybe fear. Like if I tell
fear of.
the kids, if I tell the kids that I can't remember stuff, what if they put me in a nursing home?
Yeah. What if they take away my independence?
Yeah.
What if they take away some of my freedom?
And you may be watching this, say, well, that's not a thing for us. We wouldn't put our mom in a nursing home. That's not, we're not even thinking about that. And, if she needs help, we hope will tell us, and we would gladly help. But
I don't think you can rely on them to tell you. Most caregivers that I talk to, they start noticing things, and and I always ask this question when new people come to the support group meeting: how long was it before you actually got a diagnosis that you began to notice something was just not quite right? What do you think the answer is? Typically.
before when the doctor told them that, or
Diagnosis. How long before they actually got a diagnosis did the family start noticing things? How far back?
oh, I don't know. What do you think?
2 years is the typical answer that I get.
My brother's wife had Lewy body, which is a form of Alzheimer's, and he told me once that, looking back on it, he said, I could remember some stuff from like 10 years ago.
Really?
Yeah. And of course,
And
he didn't.
He was her caregiver for a long time.
Yeah, it didn't register to time, and he was just, thinking it's so easy at the early stage just to, rationalize things. But I have had people with Alzheimer's or with dementia to tell me before that they realized that, they were having issues. It's rare. Most people are very defensive about it. I met with a lady this last week, and she was very defensive about it. And the kids, may not have handled it exactly right. They was I thought maybe a little too confrontational. But, people a lot of times are very defensive about it. They're afraid, especially if they've been like a professional person or a business person or very independent, always taking care of their own business, and to admit it to one of the kids, there's several things here. This is one of your kids,
And if she was the mom,
She was
she
the
was the
mom.
mom for 40, 50, 60 years before these kids step up and say, hey, it's like now they're wanting to be the parent.
Yeah.
Or in the parent role.
So it's like you're kind of like if you're having issues, it's like I'm not capable of managing this company anymore, this company named
Yeah.
Mom, and I'm going to kind of step aside from this, and I'm turning over management of Mom over to one of the kids, and now they're going to manage Mom. Think I'll just keep quiet and continue to manage Mom myself. Yeah, I mean, they're afraid. They're afraid that and I've heard this from different ones. Afraid of what's going to happen, afraid of losing their independence, um, afraid of like what's the next step. Am I going to go to a doctor, and the doctor going to prescribe certain medications that I wouldn't want to take? At the early stages, it is scary, and so. Don't want to just raise a problem without leaving you with a tip. We're doing a new book called The Mom-Centered Family Meeting, and the whole purpose of it is the family getting together to discuss things that can be done for the benefit of Mom, like coming up, the family working together to coming up with a going forward plan. And it's got to be carefully done, particularly at the very early stages. You do not want to approach Mom or Dad, we're using Mom here, but Mom or Dad or spouse, don't want to approach them in a confrontational way. Hey Mom, something going on, we need to do something about that. That probably won't work. It needs to be in a patient, kind, and loving way.
Yeah, but it may be that Mom doesn't really recognize that she's having issues because she may be declining cognitively. So you need to give her some credit, to respect her and how she feels about this and the emotions it's causing within her. If you're trying to say, Mom, you need some help, I think it'd be better to say, hey, can we help? Instead of it's all
with that.
about a matter of approaching it.
And a lot of times it takes more than one bite at the apple, meaning you don't expect that you can just like all the kids blow in one weekend. Hey Mom, we need to talk. Boom, we got places to go, people to see, things to do. Let's knock this out and come up with a solution and move on. You may have to broach the topic and broach it 2 or 3 or 4 times or more. And in the meantime, if the family is local and can be there to help, or if Mom will accept a non-medical caregiver that can be there part-time, it's a place to start being more present, being there more to help, offering to do things that she may not want to do anyway, like pick up her groceries or pick up her meds at the pharmacy, or
Clean the house, wash the
or
clothes.
just to be there to help. And I know with your mom it started with just a few little things, and it started being more and more. But just be cognizant of these things, be there to help, and do what you can. It takes a village, it takes a group of family working together, but together you can get a good going forward result for Mom. And I know we're way over a 5-cast limit today of 5 minutes, but we appreciate you watching, and we will see you on the next video.
And thank you for being a caregiver. You're making a huge difference in someone's life.